VCY America presents Crosstalk, a nationwide call-in program discussing issues that have an effect on our families, our communities, our churches, our nation, and our world. Crosstalk, an opportunity for you to voice your concerns for biblical principles. And now live by satellite and around the world on the internet at vcyamerica.org. Here is today's Crosstalk.
And thank you for joining us on Crosstalk today. Ladies and gentlemen, we recently came through an extensive government shutdown. You remember that? Well, it was due to the demands of the Democratic leadership to extend the Obamacare subsidies. We'll discuss that today, along with a comment that President Trump has made about giving money directly to Americans rather than to insurance companies. We'll break that down and see what that looks like. Also on the docket today, some discussion on Medicare. Our guest has put together an extensive workbook on this issue, and Real ID. Our guest presents a case against Real ID and warns about this being a federal digital ID system. And while there is an effort underway to repeal Real ID, we also have the TSA instituting an $18 fee on travelers without Real ID. Well, there's that and more to talk about on Crosstalk today as we welcome back Twyla Braze. She is the president and co-founder of Citizens Council for Health Freedom. They're a national, patient-centered, privacy-focused free market policy organization to support healthcare choices, individualized patient care, and medical and genetic privacy. Twyla is a certified public health nurse, author of the 8-time award-winning book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. She's also speaker on the Daily Health Freedom Minute, heard on stations across the country. Twyla, thanks for joining us here today on Crosstalk.
Well, thank you, Jim. I'm always glad to be here. Thank you.
So let's begin with this recent government shutdown, the longest in U.S. history. Democratic leadership, Hakeem Jeffries, Chuck Schumer, and others brought about the shutdown due to Obamacare subsidies that would be coming to an end and skyrocket the cost of premiums. Twyla, did I miss something? I thought this was called the Affordable Care Act.
Yes, what do they say? The chickens are coming home to roost.
Yeah.
The fact of the matter is, it was never meant to be an Affordable Care Act. That was very much, propaganda, giving it that kind of a name. It was, after it was passed, it was considered, well, it was actually said to be a redistribution or a correction of the maldistribution of income in this country. That is what the senator from Montana called it. He said, at last we have corrected the maldistribution of wealth in this, or maybe it was income, in this country. So it was never intended to be whatever they said it was. And then Bloomberg government, after it passed, called it a $1 trillion windfall for the health plans within the first 10 years. So whatever was said about doctors and coverage and affordability, that was never the plan. This is all about a transfer of wealth and a change toward socialized medicine for this country.
So we're on a collision course, it seems, skyrocketing rates. I understand there's supposed to be some kind of vote coming up later this month.
Yeah, so, what the Democrats want, and they made all sorts of claims, right, that the Republicans were, going to be the cause of this essentially almost doubling of premiums. But the fact of the matter is, 5 years ago during COVID, it is the Democrats that put this provision into place, all of these Obamacare subsidies for the middle class. And so I don't think they expected, and they put on it a sunset language or an expiration date of, the end of this year. I don't think that they expected there to be a President Trump, that would stop them from simply lifting the expiration date and just keeping these people permanently in government-run health care. Mm-hmm. Because, of course, for the Democrats, their plan is single-payer system, a socialized health care system. And I believe their plan is to get it subsidy program by subsidy program. So I think they just simply expected, okay, during COVID, we'll add these people, that's great, and we'll keep them in forever. And that will just bring us closer and closer to the socialized system, the universal healthcare system that we envision. So this is the Democrats' problem, that we have these people who are losing this coverage. But it also shows you how because this is all taxpayer-funded coverage. It's coming from the pockets of people who are having to pay their own high premiums, and then they're paying double in order to cover all of these other people. And so now we see how very unaffordable it is, because it's all, any kind of affordability that you thought was part of Obamacare was all being masked by all of these taxes of the American people. And now that they want to take that back and relieve the American people of this extra, these subsidies, cost of these subsidies, now we can see how many billions of dollars this is costing taxpayers. It was never affordable.
Yeah, and I think, and that's what's important to point out here, is that this is not all of a sudden caught by surprise that we've come to this. This is really by design, isn't it?
Yes, they designed it to go on forever. They just didn't expect President Trump or the Republicans to stand in their way at the end of 2025. And so now there's a really big decision that must be made by the Republicans and by President Trump. And we are shortly going to be sending President Trump a letter. It's going out within, it could be hours. And it's going to be asking him to hold strong and do not extend these subsidies. This idea that he's kind of wavering and saying that maybe we'll extend them for 2 years. No. That's like getting to the end of his presidency, and then it's just a matter of will they get Democrats, and then they'll just make it permanent, which is what their plan is.
Yeah.
Instead, we've got a better idea for him.
We're going to talk about that better idea, but he has also floated the idea of giving healthcare dollars directly to patients instead of to the insurance companies. Senator Rick Scott said we're not going to repeal Obamacare, we're going to fix Obamacare. So fill in those blanks about such a proposal that the president has, what you heard from Senator Rick Scott, and how do you analyze that?
Well, it all mixes in with our better idea, because one of the things when President Trump said that we're going to give the money to the people, well, this is wonderful thinking, because this is getting us back to a cash-based economy for healthcare. And that is where we've got to go, because we need cash, catastrophic coverage, and charity. That's what we call our 3C solution. So he's got a good idea going there. But unless he actually brings back catastrophic coverage, then it's just giving people the money to give to the health plans, which were put in place by Obamacare when they took away real health insurance, catastrophic coverage that is very affordable and is just there for catastrophic and insurable events. Obamacare got rid of that. That's very, very affordable. You stick it in a drawer, and most people don't have catastrophes, and then that brings the price of everything else down to the pocketbook. That's how it used to be. So in a sort of a tweet back to him, or a post on X, right? I just said to the president, it's not enough. It's the right way, but it's not enough. You've got to force Congress to get rid of the prohibition on catastrophic coverage. Everybody wants catastrophic coverage. It's very affordable. It's there only for the things that they're afraid of, right? That's what we need insurance for the things that we're afraid of. And then everything comes back to the cash pocketbook pricing. And then for the people who really can't afford it, there's charity. And charity is really affordable. So he's got the right idea. Go back to cash. But he's not taking it far enough. And he's got to force Congress to bring back catastrophic coverage. Just repeal that little segment in the Affordable Care Act that says it's not available for anyone over the age of 29. That has to go away.
Twyla Bray is with us here today, Citizens Council for Health Freedom. And Twyla, I'm going to interweave in this what we're talking about here, the plan forward. You've been an advocate for a long time of medical freedom. Define to our listeners what medical freedom is, and is that truly obtainable?
Oh, it's totally obtainable. So medical freedom is the ability for the patient and the doctor to work together for the benefit of the patient without outside interference. And it requires and means that it is affordable to the patient, but it's also, reasonable for the physician. So it's affordable, it's confidential, and it's without outside interference. That is the healthcare system that we had before the government decided to involve itself in medical care with Medicare, Medicaid. Even employer-sponsored coverage has trapped people into groups and usually into one plan when they should be getting the full compensation of their wages instead of having a larger and larger slice of their wages sent to a health plan with the legal authority to deny them access to care. They're losing. They're losing wages. They're losing raises. And people don't understand that, but it's so important to let people have their full compensation, give them the cash, and then let them buy their own catastrophic coverage.
So with all that being said, you actually have a number of proposals for medical reform, medical freedom. You already talked about allowing the catastrophic coverage for all. What other tools would be available, proposals that you would have?
Well, I think it's important, the health savings account. A lot of people like their health savings accounts, but it needs to be freed. People don't understand that when the health savings account became law, there's a lot of negotiations before that happened. And the health plans, these very, very powerful health plans, essentially came to Congress and said, okay, we don't mind if you do HSAs, but we want them to be linked to our health plans, our high-deductible health plans, which are not high-deductible insurance. It's a completely different beast. But anyway, so you can't get a health savings account unless you have a health plan. You can't get a savings account, a health savings account, if you have a catastrophic policy. If President Trump worked with Congress and got that back for us, you couldn't get a health savings account because it can only be attached to a health plan. And that was, some of the health plans, they got banks. They built banks after that so they could have your HSA dollars in their banks earning interest for them. So we need to free the HSA. Everybody should be able to get these tax-deductible HSAs to save money for their medical expenses. It shouldn't be required that you even have insurance or a health plan. Where is there in the Constitution or anywhere else a requirement that we all must be insured? I know people of great means who have decided that health insurance it's a ripoff. So they are self-insuring. They are self-insuring. They are not insured. They are using their own money to negotiate with doctors, to negotiate with hospitals, and to get the best cash price possible. So we should free the HSA. We should be able to opt out of Medicare. Nobody should be forced into Medicare. Medicare is actually age discrimination. When you turn 65, you will find it almost impossible, if not impossible, to get any other kind of health insurance. Why? Why is your money not good at the age of 65 to buy your own private health insurance that is not under control of the federal government, that is not a health plan by the federal government, that's not under a budget that, they say in 8 years it won't be able to pay 11% of all Medicare funding. Why? So let's free seniors who can to opt out and then build an entire system of catastrophic coverage, lifelong insurance policies for everyone.
Twyla Bray is with us today, Citizens Council for Health Freedom. Their website, cchfreedom.org, cchfreedom.org. Friends, wow, that's, time is flying by here. We're going to get into retirement freedom, also information on Real ID, and our guest has some great thoughts on that issue. Back in a minute here on Crosstalk.
Back to Genesis with Dr. John Morris, scientist and creation researcher with the Institute for Creation Research. Dr. Morris, when we're looking at the evolutionary scale, what animals would be considered primitive?
Chris, mammals are thought to be more advanced on the evolutionary scale, although all animals are amazingly well designed. Insects are thought to be rather primitive, but research has shown that even butterflies, as they migrate across the ocean, have some sort of built-in magnetic sense which keeps them on course. They can correct their course even if blown off course by wind. Chris, even insects were created by an amazingly intelligent creator. There's nothing primitive about any form of life. Even single-cell life is complex. If it's living, it's complex. And it's been that way ever since back in Genesis.
If you'd like to go back to Genesis, you can find us on the web at www.icr.org. For the Institute for Creation Research, I'm Chris O'Brien. Thanks for tuning in.
You're listening to Crosstalk on the VCY American Network. Twyla Braze is our guest today. She is president and co-founder of Citizens Council for Health Freedom. Today our topic, the quest for medical freedom and privacy, and talk some on the Obamacare subsidies. Friends, your member of Congress is going to be voting on that this month of December. You can reach out to them through the legislative lines there, the switchboard 202-224-3121. That's 202-224-3121. Now, Twyla, you indicated that you will, in the very near future, maybe just hours or within the next day, have a letter off to President Trump. You're going to push him to go even further than what he has suggested, correct?
Oh, absolutely. We're going to push him to use all of his power and actually the pressure of the movement, right? People are really perturbed with how their insurance premiums are going up. Mm-hmm. He cannot allow that pressure to be relieved by anything other than allowing people to have, again, the right to buy affordable catastrophic coverage. He should just hang tough and say, here's the solution to the problem. Let's repeal that section of the Affordable Care Act and let everybody have real health insurance that's for just affordable insurable events, and then that will bring all of the premiums down. So that's his solution. That should be his solution. He should not bow to anything else.
Okay, that issue, though, again, friends, before your members of Congress later this month as well as they consider these subsidies. Twyla, we're going to transition to another topic, and you pretty well introduced it here in our last segment, and it deals with this matter of retirement freedom. And you have talked about Medicare. We've done a full program on that before. You've got a booklet we'll talk about here briefly as well, but you're trying to also end with the coercion into what's called Medicare Advantage. So comment on these issues pertaining to this topic.
Yeah, so Medicare Advantage is often sold as a zero premium plan, really great for people who don't have significant means. It's, the best way to go. But the fact of the matter is, ultimately, Medicare Advantage, which is the health plan version of Medicare, Medicare Advantage is the non-freedom version of Medicare. It is the one where the health plans might not charge you anything, to be in the plan. I think 70% of people with Medicare Advantage have zero premium. So they just think they've got a free deal here going on. But they have to look further than their premium, because ultimately, if you've got something significant that happens to you, there are two things you're going to face. Higher expenses than you thought, and higher expenses than you would probably have if you were in original Medicare. And then they're also going to face the possibility that the care that they need will be denied. In original Medicare, that doesn't happen except very, very rarely. Whatever the doctor says you need, Medicare pays for. In Medicare Advantage, you have to go through prior authorization, and your health plan can decide you don't need that, it's not good for you, we don't care what the doctor says, or it's experimental, or yes, the doctor ordered 20 treatments, but we're only going to pay for 5. You're going to have to pay for the rest out of your pocket. So there's likely to be much more out-of-pocket spending if you choose Medicare Advantage and you get sick. And one of the things that we advise in our Medicare how-to guide, which, you referenced it as a workbook, and in some ways it is, because we've got a checklist in there, we've got all sorts of things. But one of the things that we suggest is if you're not sick now and you're over the age of 65 and you're in Medicare, look at switching back to original Medicare. Because that's where you have freedom. And when you're sick, you really need freedom. Freedom of any doctor, no networks, any doctor, anywhere in the country. That's about 98% of all physicians that you could have access to. Yes, you will pay more now, but if you get sick and you need care and Medicare Advantage says no, you will pay extra just to get the care to keep you alive or keep your quality of life up. You need to think about this while you are well. Then you can probably make the switch back. What people don't understand is in original Medicare, to cover the expenses that original Medicare doesn't cover, you really should get a Medigap plan. Because even though Medicare covers hospitalization, at a certain point, a certain day, all coverage ends. And with Medigap, coverage never ends. It's 365 days a year of coverage for the things that Medicare doesn't pay for. And so, but what you need to know about Medigap is it doesn't look at your medical conditions for the first 180 days after you enter Medicare Part B. After that, it can medically underwrite you. So let's just say you've been in Medicare for 2 years, 3 years, 4 years, whatever. You're still healthy. You hear this information and you think, oh my goodness, when I'm 80 and sick, I want to have original Medicare, and I'm healthy now. You will have to go through medical underwriting to get a supplemental plan or this Medigap. But if you're healthy, it probably won't be difficult at all for you to get it. If you're sick, you probably won't even be able to, and you will be stuck in Medicare Advantage for the rest of your life.
Wow. So when one is healthy, not when one is going through a physical trial as such, that is the time to transition from Advantage to Original Medicare. And can one do that at any time, or is that just during a certain enrollment period? There
are certain enrollment periods, and our guide talks about all of those different enrollment periods. The enrollment period that that just ends on, I believe, the 7th of this month. I believe that's when you can switch between the two. I haven't just looked at this, so I'm glad that I wrote a guide, or I partially wrote the guide to make sure that I know the details. But the fact of the matter is there's another one that begins in January and goes through March. But I believe that one is simply for making changes within Medicare Advantage itself. I'm not sure that during that time you can switch back to Original Medicare. I think that might only be in the enrollment period that is ending on December 7th, I believe is the date.
Okay, and that would also be true that one can choose that when they're first enrolling into Medicare, when they're just turning 65.
Yes, and there are 10,000 people a day turning 65 and becoming Medicare eligible. So I hope that your listeners who are in that category will get our guide. You know, I as a nurse, it's really important to me that I help people make the best decisions they can to get the best care that they can, which is part of the reason why we wrote the guide. And we have had people in the Medicare administration say that it's a real service to Americans because there are things in here that they can't find elsewhere and they won't tend to find elsewhere. I've had other people who have used it who have said that it has made their job easy. They know exactly what to do once they have read the guide. So I really hope that your listeners will take advantage of it. It's free. It's online at cchfreedom.org, our website, cchfreedom.org. You can just put in Medicare and the guide will pop up where you can, find it on the homepage.
Friends, again, I'll repeat that website, cchfreedom.org. That stands for Citizens Council for Health Freedom. cchfreedom.org. In their search, just put in Medicare, and that guide will be one of the things that will come up there. You can download that at no cost. The clock keeps ticking here, Twyla. I'd like to talk now about spend the remainder of our time on Real ID. We saw huge pressure and push for Real ID several months back, and we're told that you must have this in order to fly. We were told that this needed to come about due to the terrorism attack in 2001, and so they put this all together in the legislation 2005. And I know that there's a present effort to repeal this. We'll get to that a little bit later, but you have studied the issue here of Real ID. Lay out the concerns that you have regarding Real ID.
Yes, I will say that we are leading the charge in the nation against Real ID. People have to understand what this is. Most people think that this is just a driver's license with a star, and I encourage all listeners to get out your ID wherever you are and see what do you have. If you've got a star, or if you're in Washington State and you have a flag, you have a Real ID, which is not a state driver's license. This is a federal ID under federal control, and the federal government is letting the states keep it looking like a driver's license, and they're allowing states to use it for driving privileges. But it is a federal ID under federal control. The DMVs have testified to Congress of their plans to digitize it, put it on our phones, and have remote real-time access to it. They are building a digital ID system in this country, and if you have been watching the news in England, you will see that Starmer is telling people in England, if you don't have a digital ID by January 1st, you will not be able to work. So this digital ID system here in the United States, the law says it does not have to be limited to use for flight. It says it can be required for any purpose that the Secretary of Homeland Security shall determine. It could be required like any other national ID. This is a national ID. It's a federal ID. It's national ID. It's nationalizing identification and nationalizing control over your life. What the law says is that the Secretary of Homeland Security can expand the number of required uses. So like in any other country that has a national digital ID, it could be required to open a bank account, to get money out of your bank, to get married, to go to college, to pay your taxes, to drive, to rent a car, rent a hotel, anything you can think of. But it would not, and vote even, but they would be all under federal control. This is a card under federal control. Essentially, the federal government has hijacked the state DMVs, and they have commandeered, which is a violation of the 10th Amendment for states' rights and for your individual rights. And it requires a biometric. So they're building a facial recognition system in this country through the Real ID. It's a biometric photo that is required on the Real ID, but the rule says that they can increase those biometrics. So like there are already 2 states that are also requiring thumbprints, Oklahoma and Colorado. It could eventually get down to your eye scan or your DNA even that is put on this federal ID. So people can get, the last thing I should say is you have to think about China during COVID and what you saw, because that's what's being built here, is a China-like social credit system. The rails, the framework, this is what's being established. It's digital, biometric controlled, and for anything in your life that the Secretary of Homeland Security shall require it for, under federal control. So you have to see it for what it is and realize you've got to get rid of it. So we have an entire website, refuserealid.org, refuserealid.org, where you can get more information. You can get information on how to, quote, lose your Real ID, which means to turn it back into the DMV and ask for a state driver's license again. And then there's a map on the bottom of this page, a red map. And so for people who make the switch, we just started this map. If you make the switch, come and register that you made the switch, and the numbers will increase on our map. And people all over the country are making the switch back to a state driver's license to thwart the federal government and where they're moving here. Just imagine if Gavin Newsom was our president or AOC, right? They want you to stay in 15-minute cities. And once your ID is digitized on your phone, they'll know when you move.
Friends, it's amazing. Our guest, Twyla Braze, today, the website she just gave, refuserealid.org. Well, friends, there's more information to discuss on this. We'll pick that up on the other side of the break, including a legislative effort to repeal it on a federal level, and states are getting engaged as well. Back in a minute here on Crosstalk.
Often, the sounds of traditional Christmas carols are missing this time of year. The secularization in our society does not want to recognize those carols which point to the Christ of Christmas. VCY America is making available Sounds of Christmas, Volumes 3, 5, and 6. The various selection of Sounds of Christmas features the music of the season as played by Vic Eliason on the digital piano, Hammond organ, and Allen organ. Songs like Go Tell It on the Mountain, O Little Town of Bethlehem, and Joy to the World. These instrumental CDs are perfect for playing in your home, office, or car throughout the season. Each volume of Sounds of Christmas is available for a donation of $6 each, or all 3 for a donation of $15 to VCY America. Call 1-800-729-9829 and have a Merry Christmas.
quest for medical freedom and privacy. Our topic today with Twyla Brase, President and co-founder of Citizens Council for Health Freedom. And friends, let me again give out those websites. No doubt some of you are running to get a sheet of paper saying, I hope they announce those again. Well, the main site, and if you were wanting information like that guide on Medicare, cchfreedom.org, cchfreedom.org. Right now we're talking about Real ID, and the website Twyla gave is refuserealid.org, and leading a national effort here to repeal this measure. And Twyla, you're up against the forces here because it was in November or early that we saw that the TSA was starting to give a $18 charge for an identity check, a fee, if you will, or a fine, as you would call it. And now just announced, and I've got the article here, and you brought it to my attention, December 1st, this article from the Daily Signal, TSA to let travelers without Real ID now to pay $45 for an identity check. There is great pressure for people to get the Real ID.
Yeah, so the federal government is strong-arming the nation. And what people need to understand is that 44% of all cards are not Real ID compliant. And our goal is to move that up to 46%, 48%, 50%, because they want to get all cards compliant. They want all people compliant. They have a rule, so whatever you've all thought about the May 7th deadline, it was a fake deadline. It was the beginning of a 2-year progressive enforcement period that ends May 5th, 2027. And by that time, they want every American in the Real ID system. And it is a system. It's not just a card. It's a digital, biometric-controlled system that can be expanded to all of life, not just flight. So people have to understand that moving from $18 to $45 in just 10 days, giving it now a name, TSA Confirm.ID is their new system where they're going to take a biometric photo of you at the airport. Your $45 is only going to be good for a 10-day trip. If you do a 12-day trip, you will have to go through the entire process again and pay another $45. They're trying to make it as painful as possible to get you to submit. Important. Get your passport and your passport card and use them to fly. And whatever you do, do not submit. You have to see where this is going. This is totalitarian. This is where this is going. And so you have to see it. It's not simple. It's not even added security. We did a legal analysis done by the former Solicitor General of Louisiana. He did it for us, an attorney. And he said even the reasons that they give, like extra security or knowing who's getting on the plane or all this kind of stuff, it doesn't even bear out. So this is simple coercion and commandeering to get everybody into a system that can be part of a digital global ID for the world. And people have to see it for what it is. Don't let them strong-arm you. Get your passport. Get your passport card, and the card is the same size as an ID, and just use that to fly. Don't, passport book, just leave that at home, for international travel or leaving the United States, but use your passport card to fly because this will thwart their effort. They are building an internal domestic passport, which means that you'll have to use this passport for everything. And I was just talking to somebody who visits Ukraine. In Ukraine, they have an internal passport, a driver's license, and an international passport. So this is where America is going. It's an internal passport to even travel or do anything around the United States, all under federal control, all with building a big federal database, all with creating a national facial recognition system for the country, and all completely unconstitutional. And it's up to we, the American people, to thwart them. And part of the thwarting is talking to your state legislators and saying, I get what's going on here. You have to stop. You have to do bills that repeal state conformity with Real ID. You as the people of America have got to start raising Cain, as it were, with your state legislators, you've got to text or tweet or through social into Trump and say, stop this. And we will, we're working to try and get Trump to stop it, but our letter to Trump got to some White House person who sent it to the TSA for their response to us, which was ridiculous. Mm-hmm. So you can find that letter at refuserealid.org and how we redlined it and wrote truth into the letter that we did for TSA. But it's really up to the American people. It's up to state legislators. It's up to AGs, and we're working to get the attention of state attorneys general. And then there's Rand Paul. So Senator Rand Paul has a bill to repeal Real ID, and we would like you all to ask your legislators, wherever they are in Congress, senators, representatives, to get onto his bill and to introduce a bill at the House level. So we would like him to hold a hearing. We've asked him to hold a hearing. And next week we will go to Washington, D.C. and try to move this forward because we've got to stop this.
Twyla, it is S2769, S2769. And it's a rare piece of legislation for Washington because it's just under 2 pages long, and it's about a page and a half, and it is to repeal the Real ID. It's called the Safeguarding Personal Information Act of 2025, and it's simply that of repealing legal ID. Now, Real ID, I should say. Now, Twyla, I checked the congressional website just before coming on air, and I see this legislation by Senator Paul, S2769, to repeal Real ID has 0 co-sponsors at this point. Is there really no interest on the part of senators and House members to sign on to this legislation?
Here's what I think. I think that many of your listeners are hearing for the first time what Real ID is. And I believe that most members of Congress have bought the lie that this has something to do with security and terrorists and the border. It's not going to protect the border whatsoever. There's 19 states that give IDs to illegals. It's not going to stop illegal immigration. But I think they've bought that. They don't understand what it is. And so they would think, well, why would we do that? That's not protective to the country. And all the time they don't realize. And they're not hearing from you, the American people. They're not hearing. And they need to hear. And they need to hear that you don't want to pay $45 as a fine, in order to fly in a country where you are free. And they want you to have a federal ID. They don't want the states in charge anymore. So don't give up your constitutional rights. Tell your members of Congress, tell your state legislators that this is what's going on. You have to draw their attention to this because they probably don't believe it. It's all about security and protecting the country, and it isn't.
And a matter of fact, yeah. I'm looking at the Daily Signal article on this, Twyla, and evidently this fine of $45 is to take effect beginning February 1, it appears. But it says that the new option maintains TSA standards, the official said, and ensures the agency will keep bad actors off the airplanes and that TSA knows the true identity of all passengers. So that's how it's being billed. Right.
But, just think about what's happening in our country and all these people who are getting Social Security numbers and IDs and driver's licenses who are illegals. What does it matter that they know who went onto the plane? Do they know if that person is a terrorist? They do not. So this idea that they will know everybody, and that the federal government will know everybody. So this is a country of 50 states who gave the federal government limited power in the Constitution. But what we have right now is a federal government saying that we will take over the states. We will take over identification. We will nationalize identification. We will take over control of everything that you do with a law that says that the Real ID can be required. This federal ID can be required for this purpose and this purpose and this purpose, not just flight, but anything you can think of that they could decide, like even to work or even to apply to get a job. Somebody just contacted us and said, the application for this job asked me for my Real ID number. Well, She didn't have a Real ID number, right? So look how this could expand. Look at the control and people have to say no and tell others, but also you've got to speak up to your state legislators.
Friends, our phone number to Crosstalk today, 800-733-9829. Our number, 800-733-9829. If you have a question for Twyla today or a very brief comment, 800-733-9829. Now, Twyla, you mentioned where some countries are taking this already and using for identification. You pointed us to China, that social credit system, and if they deem that you're a bad actor in the eyes of the government, you're not complying with their mask rules or whatever. I mean, all they got to do is dock you and turn your card from green to red to prohibit you from buying or selling or boarding this plane or that train or whatever it might be. And at the same token, being confined to certain areas, not being able to travel outside of certain areas. So we see where that's going, but at the same time, I understand that though the federal government is trying to push this at this time, there are states that are taking action individually on this, and a number of states getting engaged and saying, no, we're not going to go that direction. And I know that a number of states have put together legislation to put a stop on it. I don't know of any state that has yet nullified this, but give us your assessment of that matter.
Yeah, no state has yet nullified it. We are working with, I believe it's 10 states, and it's a combination of resolutions out of the legislature against it. That's the kind of thing that they're working on, or language to completely repeal conforming with this Federal Real ID Act. Or there are other bills that would say things like no biometric photo can be taken in the state of X, right? So there's sort of the idea of putting poison pills in there that will totally stop, like the facial recognition system that's being built across the country. So yes, state legislators are starting to move on this. They're starting to realize what this is. In the state of Maine, Representative Laurel Libby, she actually has Democrats. She's got 5 Democrat co-sponsors on her bill, and it was heard in a House of Representatives hearing. But it didn't go any further. But, this is what it's going to take. It's just going to take continual pressure, continual awareness, continual realization. They would like to just pull the wool over all of our eyes, convince us that there's no way, convince us it's inevitable and there's no way that you can win. And I just feel absolutely positively sure that we are in this battle to win. I believe that God has put our organization in this position. We fought it in 2016, 2017, fought it in 2008, 2009, and even I was involved in something way earlier, 1997, a MIN card that the state of Minnesota was trying to put forth. So our organization's been in this battle for a very long time. We probably have the most information on Real ID of anyone outside of the government, and I just believe that we can win this battle. But everyone has to move and start to stand up and tell everyone else and make noise with people who can do something, and every American can do something. They can simply resist, refuse to get it, or get rid of it.
Friends, our phone lines are packed, and we'll take your calls right after the break. Twyla Braze is with us here today from the Citizens Council for Health Freedom, their website, cchfreedom.org, and on the Real ID issue, the website is refuserealid.org. We'll take your calls here in just a moment. This is Crosstalk on VCY America.
For the Worldview Report, I'm Brandon House. Our website's worldviewtube.com. Recently, I was listening to the interview again between Norman Dodd and my friend G. Edward Griffin. Norman Dodd was the chief investigator for a congressional committee in the 1950s known as the Reese Committee. They were investigating how major foundations like the Rockefeller Foundation, Ford Foundation, Carnegie Foundation were reportedly using their funds to grab up historians to write textbooks for America's students, to not teach the Constitution or the idea of individuality, but the idea of collectivism. And when he was asked why these foundations were doing that, he said, well, it's for a couple reasons. One is they want to redo the Revolutionary War, to roll America back into being a part of Europe and to roll us into the Soviet Union. Well, this seems to fit with Bible prophecy, does it not? A Eurocentric world government. But he also said they wanted to create a administrative state, America into a corporation. That sounds like technocracy.
This is Crosstalk on VCY America, and friends, just earlier today from Alex Newman, he just covered this story as well. He said Missouri just took a significant step in the battle against Orwellian digital IDs and the broader digital gulag being planned for humanity. Senator Joe Nicola, who is also a pastor, filed legislation in his state to prohibit a compulsory digital ID, leave an option for paper ID, make it an opt-in, prohibit abuses, and also enforce all the provisions of the law with big fines for violators. Ultimately, he says digital ID, central bank digital currencies, online censorship are tied together. The senator told Alex Newman, if all three are enacted, our freedom and liberty are over, he concluded. Twyla, I know you mentioned that Rand Paul had put together legislation. You've encouraged people to contact their legislators. Is it important that they also contact Rand Paul?
Oh, it's essential. Wouldn't it be great if he hears from people all over the country who affirm what he has done? Thank him. Everyone should call him. And really, I've been in his office when the calls come in. Calls are really important, much more important than any other kind of contact. Call him and say, thank you so much for your bill to repeal Real ID. Please hold a public hearing on that. We just need to get the word out. So just thank him. I think that'll make a big difference.
His phone number, by the way, is 202-224-4343. 202-224-4343. Let's go to Tammy in New Berlin, Wisconsin. You're on the air.
Hi, thank you for taking my call. I'm age 64, and I'm a member of the Healthcare Sharing Ministry, Samaritan Ministries, and I would like to know what else I would need to do when I turn 65 if I would like to stay with Samaritan Ministries.
Okay.
So, yeah, that's a very good question because, to my knowledge, Samaritan Ministries is the only healthcare sharing organization that does not require you to go into Medicare. Now, the problem with this is that at the federal level, because of the Clintons, they tied Social Security benefits with enrollment in Medicare. So in order, and we got a bill, the Retirement Freedom Act by Cruz and then Representative or Congressman Gary Palmer, to give people the right to opt out of Medicare without losing their Social Security benefits. But that hasn't moved forward yet, but we have those bills. So at this moment, when you turn 65 and if you want your Social Security, you will have to enroll in Medicare Part A in order to get your Social Security benefits. But you can stay on Samaritan Ministries, for the rest of your life, because they are the only one who doesn't say you must go into Medicare when you turn 65.
Thank you, Tammy. We've got a caller from Albuquerque, New Mexico. You're on the air.
Hi. Thank you for taking my call. I would like to talk about Medicare.
What is your question, ma'am?
Oh, I was directed to go to a plan rather than Medicare, and to go back to Medicare, it'll cost me a lot of money because I'm diabetic and high blood pressure and asthma.
Yeah. And Twyla, you warned about that earlier.
Yeah. I guess what I would say is that it's probably impossible for you to go back. You're talking about the cost anyway, and so it will cost more to be in original Medicare, but that is where you have freedom. But you are unlikely to be even able to go back to original Medicare because you are probably not going to find a Medigap plan to cover you for any of the uncovered costs. So I would just, if you have further questions, I just ask a Medicare agent. And of course, they probably steered you into the plan because a lot of them do. The Medicare Advantage is, they have a financial benefit to get you into a Medicare Advantage plan and a higher financial benefit. So I would just, stay as you are because that's probably your only option.
Thanks for the call. Matt in Findlay, Ohio. You're on the air.
Hello?
Yes, go ahead.
Hi. I have a question for your guest and comment, and I just wanted to see what she had to say. So I think Real ID, the digital part is not so great, but the new standard where you need to have a driver's license with either a star on there to fly, I believe it does stop the illegal people that are easily get a license from Seattle, California, New York. And I don't understand why she says, oh, that's bad. I think it's good. We know who's on the plane, and I agree with that statement.
Okay.
And
so let me have her address it. Yeah, let me have her address
ID,
it.
We do have a passport already. U.S. citizens have passports, and it's already federalized with your biometrics. So what's the deal? And did she vote for Donald Trump? I'll listen on copy.
Okay. We're not going to talk about who she voted for, but let's deal with the issues at hand here today, Twyla.
Yeah, so a lot of people say, well, we already have passports, so what's the big deal? The big deal is, number one, that the Real ID is a system, a digital biometric controlled system for all of life, not just flying. The passport is to get you in and out of the country, to say that you're an American citizen, and if you want to fly to England, you'll have that passport in England, and they'll know that you're an American citizen, but you'll be able to come back to America because you have an American passport. That's what the passport is for, is to get you across borders in and out of America. This is meant to actually control what you do inside America as an internal domestic passport, because the law says, this is what the law says, it says that the official purposes, the definition of official purposes in the Real ID Act is to enter federal buildings, to enter nuclear facilities, and to use commercial airlines, and for any other purpose that the Secretary of Homeland Security shall determine. And that means it could be like it is in all the other countries that have digital national IDs. This is a national ID card. It's no longer a state driver's license. That means that anything in life could be under federal control, no longer under state control. This is nationalized. So it is not the same as a passport in any way, shape, or form. This is meant to control what you can and cannot do within the United States with or without identification.
And we're going to have to leave it there because our theme is already closing here at the program. Thank you for the call, Matt, and sorry to others who are on hold. Twyla, we're going to have you come back just for a Q&A program.
I guess.
Thank you for being with us here today. Twyla Braze from Citizens Council for Health Freedom. The website, cchfreedom.org and refuserealid.org. Again, Twyla, thanks for being with us. And friends, we thank you for joining us today here on Crosstalk.
You've been listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Tape Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208, or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.